So now let's talk about the mobile solution. This is from the Hippo virtual care platform. Like I said, it's an American-based company. It's really now revolutionizing the world of virtual care. And that's one of the things I like the most. Is really a clinician-led company. So the people who are working in this company, that they work in hospitals, they're clinicians, and they know how to use telemedicine and virtual care platform in real practice. So this is what it looks like. They're using head-mounted displays. You see that on the right side, and it really bridges the gap between physical care and virtual care. So the doctor is giving advice on a distance, and it enables healthcare providers, doctors, educators to overcome the barriers of time, distance, and training. So people from all over the world can give advice to each other, especially very important during this COVID crisis. One of the things is it's hands-free, so you don't have to touch it. That's also good for preventing infection. It's voice activated, and you can really communicate in real time. One of the things is if you use a platform, you can have immediate access to electronic patient records, which saves time. And also it can be used during consultations, routing, and again, it's a recurring word, that's putting on a triage. What was used in Wuhan when the COVID-19 epidemic broke out. And it was used again by the frontline healthcare workers. You see the picture on the left side. And they really had high-risk patients. One of the other things is, that's also a topic which you see a lot on the internet, is the so-called thermal imaging. So the platform, there are some infrastructure solutions were involved in the hardware and are interoperable device and platform. Like if you look at patients having fever, those kind of things. So of course, if you use a new technology like this, you have to have some features for having a success. I think they're all pretty obvious. It should be quick to deploy, plug and play, no fancy thing, no hard books to read on. It's easy to use, that everybody can use it. It should of course be durable and resilient, dustproof, waterproof, networked, Wi-Fi, Bluetooth, 4G, 5G, safe and secure. It should be disinfected really easy. And one of the other things is it should be scalable and future-proofed. So the open APIs allowing for a range of third-party applications to integrate in the various systems used all over the world. It's used at some sites already. Also at the part of Johns Hopkins Hospital, Maryland. It's used in Norway by the EMTs, and also being used in Nigeria. So if you look at the use cases, there are really a lot of use cases. Point out a few. One, of course, at the emergency departments, the CAT labs, the OR. If you look at the post-acute care nursing homes, a lot of old people are now in the nursing homes, a lot of diseases. Outpatient clinics like urgent care, also with wound care, you can observe the wounds from a distance, and so that the patient will not have to be in the hospital for a consultation. And of course, very important is the remote care, like the first responders and the EMTs. Again, some pictures for clinical use in the hospital there at COVID-19 challenges, remote clinical rounds. So the doctors, nurses, personnel is not really directly in contact with the patients, but can have remote clinical rounds. Again, very important, the emergency services, real-time direct medical advice for the paramedics, which allows faster triage and a better treatment for the patients. One of the things is we're now working on thinking on in the Netherlands is putting up COVID hospitals and non-COVID hospitals. So one of the things is that because of the COVID crisis, the people who also needed medical care, who were non-COVID patients, and really had a very hard time the last 2-3 months. So you should diverge those patients from each other. Other thing very important is classroom, medical students, faculty training, evaluation of skills, and of course home nursing care and caring for patients at home, like the IV treatments of wound care, and of course sending the biometric data to the hospital. So this is my topic. One thing I would like to stress out, if you look at the first solution with the ambulance-based fixed solution, that is really an off-shelf solution. It's customized build, And why is it customized built? Because all the healthcare organizations in the world are using other vital monitors, or using other kinds of vehicles. And I've designed the system, I think about 5-6 years ago, and I'm still looking for organizations, pilot partners who want to co-develop this system. And which will be a very nice combination, of course, if you use it with the head-mounted displays. Okay, thank you very much. I hope the topic and the presentation is very interesting to everybody.
Yeah, thank you very much, Dirk. I myself have a lot of questions for you, but let's wait for our participants, our attendees, to forward some questions. Okay, so thank you very much. You can now stop sharing your screen.